essentials of antenatal education.
Shital?
I do these antenatal classes myself, and it's not like a one-time session, so it does take place over a few weeks so that we don't overwhelm the mother with a lot of information in one go. But I do believe that we have to give the mother the right information. So I do give them a lot of medical information as well. So again, so that she's used to the medical terminology that, that will be used by her doctor. She can go and ask her doctor the right questions at the end of the day as well. So things like even the stages of pregnancy, how her body is going to change, the anatomy and the physiology of breastfeeding, let's say, how the hormones work, the nutrition and exercising that's going to take her along her entire journey, both post and pre. And post is equally important, right? Because post birth, then the mother needs to also put some time and effort into self-care, because we see that a lot of mental health issues like postpartum anxiety and postpartum depression can actually be minimized just by encouraging the mother to take some breaks and either do some form of exercise or take some time off for herself. And lastly, newborn care, how to care for your new baby on your own. Let's say if you have nobody else to help and support you. And I tend to do a little bit of first aid basics. So, things like what is good fever, when to report a fever, diarrhea and colic, and, small stuff like that. And then lastly, we also talk a lot about the birth plan, and that is what labor, the stages of labor again, what you should talk to your doctor before you, in your last trimester of pregnancy, as to the kind of hospital you want to be in. Okay. Ideally, you want to be in a hospital that has a neonatal ICU in case of baby support. When you go to a hospital, if you want to implement the no formula rule, you need to let your gynae and the hospital that you register at, let them know that ahead of time. Choose a pediatrician. Again, meet your pediatrician beforehand, and don't blindly just, get the hospital pediatrician, because the pediatrician for the rest of your baby's life. I mean, at least till the baby is an adult, right? Have a meeting with your pediatrician. So all of these things are just really important. If you've identified these people who are going to support you through this entire process, I think that again minimizes the stress and the anxieties, because then you know exactly who to call, who to reach out to, and hopefully these classes themselves will give you a lot of knowledge and, essentially power to handle the issues yourself.
Right.
So I tell them that if you take these classes, hopefully you will not see me in the postpartum period, right? Because you will be able to deal with a lot of it yourself.
Right.